Hi, Bruce. Can you hear me? Oh, you're on mute, I think.
Yes, so who's that I'm talking to?
Hi, this is Pantelis. Sorry, I can't, it's not allowing me to start my video, unfortunately, but that's okay.
Permission, Bruce, we'll get underway. Welcome, everybody. I'd like to introduce our MC for today's webinar, Professor Bruce Tong, who's the Foundation Head, School of Psychiatry and Psychology at Monash University. He's also Senior Clinical Advisor at the Mental Health Program, Southern Health, Monash Medical Centre in Melbourne. And more importantly, from the Mental Health Foundation's point of view, he is patron of the Mental Health Foundation Australia. So welcome, Bruce. And now I will delete myself.
Thank you very much, Jim, for the welcome. And welcome to everybody who's joined this webinar today from around Australia and in fact internationally. Firstly, I'd like to start with acknowledging and paying my respects to the traditional owners of this wonderful land of ours and their elders, past, present and emerging, and acknowledge their traditional ownership of our land. Today is the second in a series of 3 webinars that the Mental Health Foundation Australia is presenting. And it's making a very important statement, these 3 seminars, and that is that the foundations for mental health and resilience don't begin when you're 20 or when you're 30 or when you're 100, but in fact begin right at the beginning, early in life. And if we don't pay attention to that, then we miss out on, in fact, what is the best opportunity to promote mental health and resilience. The first of these seminars was from Professor Louise Newman, who talked about promoting attachment between mothers and families and infants, and how that is a very sure foundation for building mental health. The third in the series, which is next week, is looking at parent education and skills training for families with very young children, and how that is a very powerful way of promoting mental health. But today, we're very fortunate to have with us a good friend and colleague of mine, Dr. Kerry Bull, who's a specialist early childhood education consultant, a leading one, if not the leading specialist in this area in Australia. She's worked at Monash University. She's been consulting to the Victorian Education Department, to a range of early intervention services, such as the Mansfield Autism Service, and in particular, the very large early intervention program run by an organisation called Noah's Ark. So it's a great pleasure for me to welcome you, Dr. Bull, to this today, and you're going to talk on the importance of 2 years of quality preschool education. Now, I'm going to start with a question which might seem a bit silly and naive, but it's been put to me on many occasions, in fact, by very educated people, and that is, how on earth could preschool education, in other words, little children just occupied playing for the day at the age of 3 and 4, have anything much to do with promoting mental health and resilience, not just for them as children, but in fact into the rest of their lives?
Thanks, Bruce. Firstly, thanks for the warm welcome. It's nice to be working with you, and good to be talking with all the people that are participating today. It's a good question, Bruce, and to understand that, we need to understand the role of early childhood educators and services. We really have to go back to what we understand about early childhood development. And that is that the first years in a child's life are critical in terms of the growth, the developing brain. this is a time when neural pathways are firing in response to the interactions and the experiences that infants and young children are participating in with the people that are important to them. And in the very early years, this is primarily family, isn't it? It's caregivers, it's mothers, it's family who are providing those interactions and experiences for children. But as children are growing and developing and their social world is expanding, they start to participate in other more formal experiences and are interacting with other people. So beyond parents, siblings, extended family and so on. So for some children, they might start attending long daycare, family daycare. And for some other children, it's not until they're 3 or 4 years of age that they start attending a kindergarten or preschool program. But regardless of the program, this is a time when educators have an opportunity to amplify and extend what it is that the family's been doing. That is that they can provide further opportunities for positive, responsive interactions, which is how the brain develops in the early years, but also the experiences that are provided. So early childhood educators have this extraordinary opportunity to build on little children's experience in the social world of other children of that developmental age and stage. So it is a period of time, it's a window of opportunity really for educators to be having a role both in the prevention and early intervention, that is providing opportunities for growth and development.
Yes, that makes a lot of sense to me, I must say. But is any sort of preschool experience okay? Does it matter who delivers it or how it's constructed?
Absolutely. And I think probably throughout this conversation today, you'll hear me use the word quality a lot, and that is because any long-term impact relies on quality programming. And when I talk about quality early childhood environments, I'm talking about some of the structural things, like perhaps the ratio of adults to children. Talking about things like the physical environment. So that might be the very way in which the educator has set up the room so that it's conducive to play, to positive social interaction and so on. And when I think about the environment of preschools, I'm reminded of the word kindergarten, that in some states and territories we talk about a preschool environment as a kindergarten. And that's a German word meaning children's garden. That is setting up the environment for children to learn and play and thrive. So the very nature of preschool environments is supporting emotional and behavioural wellbeing. But when we think about quality, we also need to think about the curriculum, that is what we're teaching. And in Australia, we have an early years learning framework that guides educators about the curriculum, the things that we should be teaching little children. But we also need to think about the how we do things, or the pedagogy, the ways in which we're teaching children, the ways we're interacting with them, the ways we are supporting children to be interacting and learning from each other. Socialising together, getting along with each other. So they're all elements of quality that we need to be thinking of. So it's not enough for children just to be going to preschool or kindergarten or an early childhood service. They need to be actively engaged, learning, participating along with all of the other children in the program. So early childhood educators need to adapt the curriculum, the ways in which they're teaching young children, so that they can be supportive of them and scaffolding their learning according to the developmental needs. So in Australia, in terms of quality, we've got a national governing body that oversees the ways in which we're managing early childhood services, and services are assessed against a number of quality standards. And some of those standards are really pertinent to today's conversation because they're directly about the relationships that children have with each other, the relationships that educators have with children, and importantly in all of this is the relationships that educators have with parents. So thinking about all of the interactions and all of those that are invested in children's development. So apart from those quality standards in Australia, we also have a curriculum that I mentioned before, an early years learning framework, and it's called Being, Belonging and Becoming. And I think that says a lot about what we're talking about today in terms of children's wellbeing. And the Being, Belonging and Becoming learning framework, which is for designed for children 0 to 8 years of age. So it sees us through the transition into the primary school years, which is a really nice component of the curriculum. It also directly addresses some of the things we're talking about today. So one of the outcomes is about children having a strong sense of identity, and another one about children's sense of well-being. And those outcomes help educators to specifically address issues of resilience, building confidence, developing problem-solving skills, getting along together. So yes, quality is a caveat for it all, Bruce, is that, as I said earlier, it's not just enough to attend an early childhood program. It needs to be a quality service.
You've certainly made a strong case there, Kerry, and I like that being, belonging and becoming. But if you're talking about outcomes, how can I put it? Is dose important? In other words, perhaps I shouldn't admit this, but when I was a child, I went to something that was called a kindergarten for 1.5 hours once a month. Look what it's done to me, perhaps I should say. But are there guidelines or is there a certain amount you need, and for how long? You know, I mean, children, it's really 4 or 5 years before they go to school, so there's a lot of time in there. How much should they get?
The dosage, as you call it, is a really important question, and one that is of great interest to government, to policymakers, because it's helping inform their investment in the early years. But it's important to parents and educators alike. We all want to know how much is enough. What is it that how much time do we need to contribute to more formal early childhood services to see long-term impacts? Perhaps I can give an example of the Victorian government and their response and question about that is that back in 2016, I think it was, they sought information about this issue of dosage. They wanted to know whether their investment in 4-year-old kindergarten was enough, or whether there was opportunity to get in there earlier, if you like. That is, what if we provided a kindergarten or preschool program for 3-year-olds? So they commissioned a report, and probably the important thing before I talk a little bit about the report to know is that they called it 2 years are better than 1. So there's our answer. That's a spoiler alert for you all. So 2 years are better than 1. And the reason they came to that conclusion was they drew on research from all around the world. And if I can just cite one bit of research in particular that's often regarded as it was really groundbreaking research from the UK, where they undertook a longitudinal study. That is, that they followed little children, preschoolers, for 16 years and looked at what their outcomes were at that stage. And they found conclusive evidence that the children who had participated in a quality early childhood program were doing better 16 years later. They were doing better in terms of their cognitive skills, but also their social and emotional behaviours and skills. That research was conducted with children from a range of socioeconomic backgrounds, and the findings of that research have then been considered in other further research studies in the US, in Europe, and they've all affirmed that having 4-year-old kindergarten is advantageous in the long term. What they also found was that the children who had attended 2 years of quality preschool program were doing even better. And so we're really finding conclusive evidence that getting in there early is important if there's a quality early childhood program. And the findings of that report were enough to help the Victorian government make a decision to fund preschool education for 3-year-olds and for 4-year-olds. And for those of us that live in Victoria, we know that that's currently being rolled out, that there's a subsidised program being rolled out over the next few years so that 3-year-olds have an opportunity for 15 to 20 hours of preschool education. So this comes on the back of a very well agreed understanding that a program for 4-year-olds should be subsidised too. So across all of the states and territories in Victoria, we've got subsidised early childhood programs for 4-year-olds, and for some children that are perhaps coming from more disadvantaged circumstances, they can attend preschool for free. The preschool environments are typically offered for 15 to 20 hours a week. They're staffed by a qualified early childhood teacher and typically an assistant. So there's some uniformity about the ways in which we're providing early childhood services across Australia. So dosage is important, Bruce.
Hey, for sure. Look, there are just a couple of issues. We've had a query which we'll get onto the questions later, but I think it's a reasonable one, and that is where was that report from, or who were the authors? You don't have to necessarily cite it now, but we'll certainly provide in our newsletter in response to this references to those, unless you'd like to just briefly mention who produced that UK report.
Well, if you go to it was Victoria University in Victoria that produced the report, and I think you'll very easily find it if you put in your search engine 2 years are better than 1, Victorian Government or Victoria University, and there you will see they describe very nicely the piece of research that was done in the UK in much more detail, obviously, than I have today.
Okay, so that's it. 2 years are better than 1. Go into your search engine for that. You mentioned that one of the long-term outcomes, and presumably by long-term you mean into adult life too, and I think there's evidence for that, was cognitive skills. What actually do you mean by that? What are some examples of what you mean by cognitive skills? It's a technical term.
Yeah, so we're really talking about thinking, learning, problem solving, Problem solving in particular is really important for today's conversation, because if we're thinking about developing resilience, problem solving is one of the things that's really helpful, a skill that we can begin to teach children in the very early years of life about solving problems, asking for help. So cognitive skills are really about the thinking and learning that we're doing.
And of course, I think that means, doesn't it, that children have better skills at numbers, numeracy, and at literacy, at using words and writing words and all of that. I think that's so, is it not?
That's right, Bruce. Mm-hmm.
Okay, well now, I suppose just shifting a little bit, what do we know about how preschool children are currently doing with their social and emotional development? And I guess this is a pertinent question given the restrictions that are on our society, necessarily so because of the pandemic. But do you know how children are currently doing of the preschool years?
We do know a bit about that, and that's thanks to the Australian Early Development Census. So this is a census data that is gathered about Australian preschool children. So the year prior to school, data's gathered from their preschool teacher about a range of developmental areas. So the information is gathered about the child's physical skills, their cognitive skills that we mentioned earlier, their communication, also their social competence and their emotional maturity. So those two domains are of interest to us today. But this data has been collected over the last 10 years, and we can use that data to understand about what's happening for children across all of those domains in Australia, or we can drill down and look at state or community level data to help us understand about children's development. And the census data was collected last in 2018, and it's telling us that most children are on track. They're doing well. They're having experiences that are enabling them to be on track to be entering school, a formal school, with the underlying sort of prerequisite skills. However, there are some children that are not faring so well. And this is where the data is really helpful, because we can look at a community level, put in very specific interventions to support those children's learning and development to bring that data up. In particular, we know that in terms of the social competence and emotional maturity domains of development, that there has been a nice positive trend over the last years. So we have seen fewer children that are developmentally vulnerable in terms of their emotional maturity and social competence. That data is freely accessible for people to have a look at and play with the data, and it's a good way of communities understanding how they might respond and the sorts of supports they might put in for little children. So it's the Australian Early Development Census.
Good. I mean, there might be some people who are listening today who are wondering not just about the sense of what you're saying, which I'm sure they can understand, but what actually happens. There may be people who haven't been into a preschool for a few years, or even if they've got little children and visit, they drop them off the gate and say hello and so forth. Can you give any examples of good programs that educators are using to build children's social and emotional skills? For example, to build resilience, or does it just happen by chance? Do you know of any good programs out there?
Yeah, look, I think it's one of the things about preschool or kindergarten, isn't it, is that you can walk into an environment like that and not see perhaps all of the ways in which the educator, the kindergarten teacher, has set up the environment for learning. And for those, I'm an early childhood educator by trade, and for me it's this wonderful learning opportunities when I walk into those environments, because I can see that the educators are using good strategies to help children get along with each other, to understand each other's feelings and emotions, to be able to regulate their own emotions. And they're doing this in so many small ways. For example, if we walk into a preschool environment, we might see a painting easel that's set up with 2 sets of paints. So the educator is deliberately structuring the environment so that 2 children are painting on the one painting together. They're being encouraged to share, take turns, talk, socialise, work out and problem solve together what it is they're doing. So there's all of these lovely informal ways in which educators are supporting emotional and behavioural skills. But there's also some other good evidence-based programs that are much more comprehensive in nature. The one I'm most familiar with is what's referred to as the pyramid model. It comes from America, and it's a tiered approach to supporting social and emotional behaviour and positive behaviour supports as well. What I mean by tiered is there's a pyramid, if we can think of a pyramid, and the bottom layer of the pyramid is focusing on all of those strategies that a teacher would use for all children. That is good, responsive relationships with the children and between the children, and also setting up a quality supportive environment so the children are feeling safe and ready to learn. That is, they're coming into kindergarten knowing what the expectations are, having a routine, knowing what it is that how they need to behave and be in that environment. So that's the bottom level of the pyramid. The next level is more targeted social support. So this is where an educator would be setting up specific teaching strategies to help children to regulate their emotions, to understand both their own and other people's behaviour and emotions. So they're really very targeted supports. And then at the very pointy end of the pyramid, we have intensive supports, and that's where a teacher might be putting in very, very individualised structured supports for children who are needing a lot of support with their emotions and behaviour. This pyramid approach has been well researched in America. It's rolled out into a lot of the states in America. And it's also been brought to Australia quite some years ago. There's quite a number of programs in Victoria, but Australia-wide, who are implementing this pyramid approach. And it's been researched well here in Australia and found to have good sort of what we call social validity. That is, we can take this American program and adapt it to our Australian culture. And we're still seeing good positive outcomes for little children. So that's the one I'm most familiar with. There's other well-regarded programs, particularly for parents. So, for example, Tuning Into Kids is a program that many people will be familiar with. Making the Connection is another one. It comes from Canada, but it's being well utilised here in Australia as well. So there's a number of them.
Thanks, Kerry. You mentioned social validity, and that brings to my mind something that's very important to the Mental Health Foundation Australia. We're constantly mindful of the fact that we're a multicultural community and that mental health and resilience is everybody's business, and is therefore the business of a whole raft of different cultural communities, cultural backgrounds, languages, experiences, family structures, the ways we go about raising our children that make up this great country of ours. What are the best approaches then to preschool education for culturally and linguistically diverse populations? Is what you're describing appropriate to them? What happens when it may not fit in with their view of how to raise little children? Are the principles you're putting forward as to the vital importance of this as a building block relevant to all cultures? It's a big question, I think, but I'd be really fascinated to hear your answer, and it's very pertinent to the work of the foundation too.
Mm. Well, there's a number of ways we can answer that. One is little children learn and develop and respond to the people around them and the experiences that they're participating in. So what's important from an early childhood service perspective is that we are culturally responsive. That is that we're understanding the ways in which we should be providing a culturally safe environment so that we can be providing the kind of service and support that's responding to them. I think we've got a long way to go in response to understanding how we can do this well. We do know that the children who are less likely to attend a preschool service might be those from rural communities or remote communities. They might be from non-English speaking backgrounds or Aboriginal and Torres Strait Islander children. And there's a number of reasons why that is so, but one of the things is that we need to be providing those culturally aware, safe environments. There's considerable work going on in relation to this across Australia, both in terms of investing in supports and training for early childhood educators, so doing cultural safety training, for example. But I think for me, it comes back to the importance of relationships. That is the teachers' relationships with families and with community. And I mentioned the quality standards earlier and said that there's standards around this. This is that educators must be engaging with families and engaging with communities in partnership. And this is where we can get good partnership between the community or between the family and the educators so that our programs are more culturally responsive. So I think, Bruce, there's some really nice work being done in relation to this, but we've got a way to go. Yeah.
Could you move that just a little bit away from that group to, of course, our First Nation peoples? I'd like to hear what you have to say about preschool education for the various Aboriginal Torres Strait Islander groups that we have here in Victoria and Australia more widely. And could you speak more generally about the importance of preschool education for them?
Well, again, preschool education, of course, starts with the informal education that comes from parents, from caregivers, from the broader community, the extended family. And it's critical that we understand that. It's sometimes or often said that parents or family are the first, most influential, important teachers. Not teachers in a formal sense, but teachers. They're the ones that are getting things started in the early years for their children. And we have to, as educators, understand that and then interact with Aboriginal and Torres Strait Islander families and communities in a way in which we are understanding how that's contributing to the development of the program, so that our program is not static and a one-size-fits-all, but rather responsive to all of the children and families in the communities that we're serving. So I think the issues are somewhat similar, Bruce, but again, I would say we've got a way to go. Where I see this working really well is where the early childhood service is well embedded in the community, and there's a healthy respect and regard for community and their contribution to the curriculum and the ways in which learning happens.
Yes, it's a complex matter, isn't it? And I think we need to do much more in discussing with Aboriginal communities and understanding and giving them much more say in how things are run, much more capacity to and efficacy in the provision of those services. Mind you, I think there are a number of key and leading Indigenous early intervention specialists, aren't there, in Australia, who from their own communities, and that's a very hopeful sign.
It is, and I couldn't agree with you more, Bruce. The other hopeful sign is that there's also a lot more funding going into Aboriginal educators working within a service or working within a region to build connections with community and to build this sort of cultural safety that I'm talking about. Yeah, it's certainly, as you say, a complex area.
Now we move on. There's been actually a couple of questions around this area, and it's about, I suppose, another special group. In fact, I've heard it said that there might be some children who are actually not ready for preschool because, for example, they're developmentally delayed, or they might have hearing impairment, or they might have something like autism or Down syndrome, and that they don't yet have the skills or language or the behavioural controls or the emotional regulation ability to manage preschool. Is that a good approach? Is that sound advice to give to somebody to delay entry because of developmental or emotional or behavioural difficulties?
This is something I feel very strongly about. I've worked in the field of early childhood intervention and disability for many years, and I think it's something that we need to really understand. It's about this notion of prerequisite skills. For me, the way I can best describe how I see this issue is one that was put forward decades ago by some researchers, and I think it sits really nicely with me. And that is that children's readiness for school doesn't lie just with the child. In fact, readiness is really about the environment being ready for the child. So we need to have preschool environments that are readily adapting to all of the children within the community so that they can be suiting their needs. So when we think about little children with disabilities, we don't need them to be ready to come to preschool. We need the preschool to be ready to be able to adapt to their learning needs. And there is no doubt that as with all children, we talked about dosage before, about, you know, the sooner the better. If we can be providing rich, quality early childhood programs for all children, whether they have autism or hearing impairment or developmental delay, all of those children can and should benefit from a good quality early childhood program. So this notion of waiting and until a child is ready is doesn't stand up.
Well, in fact, it seems you're saying that it's not only doesn't it stand up, but it's positively discriminatory and not in the child's best interests, ultimately. It's interesting, we've got two questions here that are about the same topic, and that's transition or school readiness, that is transition from preschool to school. One of them's a general question about that. Are there any specific approaches that can be used to help children with special needs, those at the top of the pyramid, to be ready for transition to school? And the other's a more personal question, and I thank the mother that's put that one in, and it's about her child who's as old as you can be just about when you go into preschool. In other words, it is 5 at the start of the year of the ready next year, but has got a lot of difficulties regulating his emotions, although he seems to be learning okay. Should he be kept back for another year? So in other words, we've got a personal question, which of course we can't answer directly in this sort of environment, and we might give some suggestions at the end about where help might be able to be available for something like that, or you might be able to suggest where a parent could go if that was the issue about regulating emotions. But we've got this more general question about are there programs that will help children during preschool to be ready to go to school, particularly if they've got special needs?
Mm-hmm. So I'll manage the first question about that issue of readiness, and I think I've already touched on that in terms of this notion of children being ready. It's rather that the school needs to be ready for all children. There are some good transition programs, and there's been a lot more focus on this across Australia in the last probably 5 to 10 years, where early childhood educators and school teachers have been thinking about how they can manage this transition better. And that's part of the reason why the early years learning framework I mentioned earlier, I said it was for children 0 to 8 years of age, because they're trying to manage even the curriculum transition so that it's stable across the preschool and early school years. The transition programs that I have most regard for are those where they are bringing together the parents, caregiver, whoever that might be, the preschool educator, and the teacher or early years coordinator of the school that the child's going to. And together, that group, that triad, come together and talk about what the specific learning needs are of that child and how they can manage that transition well. So if you have a child with a developmental delay or a disability, this is an opportunity to sit with someone who knows your child well, the preschool educator, and share that information with the prep teacher. The reason this triad works really nicely together is that the parent has the opportunity to share all of the wisdom they have about their own child. That is, everything they know about their child's strengths, how to help them when they're worried or need extra support, what might trigger them, all of the intimate knowledge they have about their own child. The preschool teacher has some of that knowledge too, and has professional expertise about how that child learns and how they learn, in particular when they're in a room with 20 other 5-year-olds. So together there's this richness of learning, and if the prep teacher or the person from the school is open and receptive to learning from those who know that child well, then the transition can be managed very nicely. I think what I also like about that approach is it is then about in the very early stage of schooling, developing a nice, respectful partnership between the teacher and the parents. And we know that when parents and professionals can work together well, share knowledge, communicate well, have good respect for each other, then we've got a much happier child who's able to thrive and manage that transition well. In relation to the specific question about a 5-year-old's transition, I think probably in this forum, the best advice I could give would be to talk with trusted professionals. So it might be the educator, or it might be the school where the child you're planning to send the child to. But people you trust, talk with them about the issue, and together come up with a plan. But I would put the caveat on this is that we can't always wait for the child to be ready, because for some children, if they've got a developmental delay or a disability, they are not going to have the prerequisite skills right now and may not have them again in a year or even 2 years. So rather what we have to do is what I was talking about earlier, share our knowledge and expertise and have the school ready for the child so they know how to manage that transition well.
Kerry, this mother also said that the problem with her child, her son, was really great difficulty with regulating his emotions. If you were that child's preschool teacher and the mother came along to you and said, look, where can I get help from this? Is there anybody that provides advice on managing these difficulties? Or who are the sorts of people I could see in the community to get a better understanding and maybe even an assessment of what the problems might mean?
Yeah. Well, that varies greatly in states and territories and even communities about who's available. But it might be, for example, that you could get specific advice from what's referred to as early intervention services. That is, specialists in early childhood and other specific needs. So it might be, for example, an occupational therapist or a specialist teacher or a psychologist who's got specific understanding about child development, but also about children's emotions and behaviour. And that might be a helpful place to start. The other people that are often available for children in preschool services are specialist teachers who can be called in to the preschool service to offer specific advice. So in Victoria, for example, we call them preschool field officers. They're a specialist early childhood educator and are available to provide consultancy or expert advice to educators about these kind of issues. But for the family, if they're wanting to follow it up themselves, they might contact, for example, a community health service, a psychologist, a specialist teacher to get some specific advice. You might have some further ideas, Bruce, about that.
Well, actually, I did, but we've got, in fact, another member of the audience out there who's written in very helpful advice, saying, I resonate with this mother because I have a child just like that. And it took me a year to, and this is good advice, to seek services from the National Disability Insurance Scheme, NDIS that is. Mm-hmm. And the way that this person achieved that help was by going to see a developmental paediatrician. That would be through their general practitioner, their family doctor. Now, of course, paediatricians are not universally available around Australia. There are some parts of Australia where it's very difficult to get a paediatrician, but things are improving there. Are now paediatricians that consult with remote areas via telehealth, and there are increasing numbers of paediatricians in rural centres. So that might be another source of help for this boy who has difficulties regulating his emotions. So thanks for sending that suggestion in to help your colleague parent who's also watching this program. Okay, well now, I just want to go back though for a minute because there's another question now, and it comes from a grandparent who's actually applauding the program and thanking you, Kerry, for this, but saying that she's in fact suddenly had to go back to looking after a little child because of the COVID or the pandemic restrictions. And it's been a real challenge for her because she hasn't had to look after a young child for quite some years now. And she wonders, well, firstly, is not being able to go to preschool having an impact on little children at the moment? And secondly, this particular grandmother says, how can I get into the field? Do preschools use aides or assistants or volunteers? Might there be a way that I can get involved because I can see it's so important?
Yes, well, you are important. Aren't grandparents important in the big picture of things? So there's a couple of questions in here. First is in response to the issues for COVID. There are some children who have been impacted significantly. That is, they may have had periods of time not attending preschool. Some preschools have quickly adapted and are providing incredible innovative programs online for young children, and hats off to them for being so clever in their responses to that. But for those children, there's a whole range of issues that we need to be thinking about, not the least of which is that if they haven't been to preschool for a while, they might have trouble transitioning back in. Some of those children might have some issues with separation anxiety, for example, worried about leaving mum or dad to go to preschool again. So we really need to be very mindful about their social, emotional, behavioural situation right now. But even for those children who haven't been immediately impacted by COVID, that is, that they're in a community where they've been able to continue going to preschool, there's no doubt that there's ripple effects within the community. So it might be that there's other worries and issues their parents are dealing with rather than the child directly. So I think we need to be thinking about children, little children, and their responses at the moment to our current situation really broadly. That is, what's directly impacting on them and what they might be feeling because of the worries that are going on in their family home, worries about unemployment, tensions because mum is trying to manage a home learning program with the older children as well as part-time work herself. Two-parent families where they're both working in the home and trying to manage children and learning. It's been a juggle. So I think we need to be really mindful of that. The question about where can I learn more or how can I contribute to early childhood environments is well, what a welcome that would be. Yes. Early childhood services, the quality services typically have a qualified educator or teacher, an early childhood teacher, and they also have an assistant who is typically untrained or has done some sort of entry-level training. There's also opportunities in early childhood environments for what are often referred to as additional assistance. That is another member of staff who's there because there might be one or a number of children who have got additional needs. So we're increasing the ratio of adults in the room to be able to better support the children's learning and development. But the other, you mentioned volunteering, Bruce, and yes, most early childhood services would welcome volunteers, and I know of a grandmother myself who volunteers in an early childhood environment, and she spends a lot of time sitting with children, reading, playing, and really enriching their learning experience. So yeah, I think talk to the programs in your local area and see how you might be able to contribute.
In fact, we've got a comment here too about how in Victoria, at least under the inclusion support program, services have access to an inclusion professional, and that's, I'm sure you'd agree, quite a great additional support, isn't it, Kerry?
Well, that's a national program. So the inclusion support program, those kind of supports are available across Australia.
Well, look, there are a couple of other questions still, but I'm mindful of the time, and we'll send those questions to you, Kerry, and you may perhaps write a few comments on them we can put in our newsletter, perhaps. I'd like to thank all of the participants who've sent in messages, and all of you who've joined us this afternoon, or whatever time of the day it is, wherever you are in the world. I've found it just a brilliant and thoughtful presentation, Kerry. Thank you very much. You've definitely fulfilled the aim of this series, and that is to make an extremely strong case for early in life prevention and intervention to promote mental health and build resilience. In fact, I'm wondering, our Deputy Chair of the Foundation, Jim Gooden, is online and listening, but this slogan, being, belonging and becoming, which belongs to early childhood, actually belongs to the rest of life. And I think that demonstrates, doesn't it, how if you can learn to be, to belong and to become, and that is to see a future, then you're set for the rest of your life. So it has to start back there, doesn't it? So thanks for giving us a new slogan, Kerry. Thanks to Pantelis for organising the behind-the-scenes working of the system. Thanks to everybody for joining us. Please send feedback to us so we know whether we're doing it right and it's been of use to you. And we wish you all a safe and well time in this pandemic. It's a difficult time for families, but it's also an invigorating and enjoyable time that is bringing some families closer together. So stay well, everyone, and stay creative. And thank you, and farewell for the moment.
Thank you. Goodbye. Thanks for the opportunity.